Member from Windsor West.
Thank you, Speaker. My question is to the Minister of Health. Every day, the minister gets up and tries to deny that Liberals are cutting patient care. But patients and nurses in Windsor know what's really happening. The Liberals have frozen hospital budgets for 4 straight years, and that's forcing Windsor Regional Hospital to cut 169 registered nurses, more than 10% of its RN workforce. Now, American hospitals like Beaumont Health Systems in Michigan have come to Windsor to hire nurses who have been cut from our hospitals. RNs are being interviewed one day and hired the very next. These nurses should be working in Ontario's hospitals, not being forced by this government's cuts to leave the country just to find work. Can the minister tell us how many nurses who have been cut from our hospitals by this government have been hired by American hospitals that are only too thrilled to take our highly skilled and dedicated Ontario nurses?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. I appreciate the question. It gives me the opportunity to talk about Windsor Regional and helping, I think, the public understand.
I guess reminding people of warnings is not good enough, so the member from Kitchener-Waterloo is warned. Carry on.
So in the first instance, we did provide Windsor Regional Hospital with $7 million additional funding this year to help them address their budget pressures, Mr. Speaker. But the important thing, I think, to understand is Windsor Regional is one of only a handful, only a few hospitals around the province that never made a transition to look at its nursing services from a holistic, comprehensive perspective, to understand that there is a role for RPNs, registered practical nurses in our hospitals, for example, that there is a role for nurse practitioners, that there is a role for RNs. In fact, Windsor Regional Hospital is one of the only hospitals in the province that has up to date a 100% RN nursing workforce.
Thank you.
They're working to change that mix so it's most appropriate for the patient.
Thank you. Supplementary.
Thank you, Speaker. Back to the Minister of Health. The Liberals' cuts to hospitals are devastating for patients and nurses in southwestern Ontario. 169 registered nurses cut in Windsor, and even more frontline healthcare workers cut in Sarnia, Hamilton, Waterloo, London, St. Thomas. The list goes on, Speaker. Those cuts mean longer wait times for patients, more worry and stress for loved ones, and they leave our nurses feeling discouraged and frustrated by a government that just doesn't share the priority of Ontarians. And when nurses are laid off, families can't just pick up and move across the province to find a part-time casual nursing job somewhere else. Instead, these nurses in our border communities are forced to look to the private healthcare system in the U.S. for jobs they can't get here at home. When will the Liberals stop cutting our hospitals, stop pushing Ontario's nurses to take jobs in Michigan, and start protecting patient care in all of our communities?
Minister.
Well, Mr. Speaker, I did mention that an additional $7 million was provided to Windsor Regional Hospital last year. In fact, our funding in the last decade to that specific hospital has increased by approximately 50%. So the funding does increase, and it doesn't include other substantial funding, the $1.9 billion I referenced earlier this morning for decreasing wait times, some of that funding distributed to Windsor Regional as well. But they are undergoing, the hospital, and I think we should leave it to the experts, to the local leadership as well, as to make sure that the mix of nursing and other staff in the hospital truly meet the patient needs. It needs to be a patient-centered system. Windsor Regional is one, as I mentioned, of just a few hospitals around the province that hasn't yet made that transition, recognizing and, quite frankly, respecting the role of our registered practical nurses in this province and understanding that they do have a role to play in our hospital. Those are the changes they're trying to make.
Thank you.